So this clinical vignette states a 12-year-old boy present in OPD with complaint of usual behavior, difficulty in swallowing, unusual behavior, difficulty in swallowing, difficulty in walking, tremors. Okay, he has jaundice as well, ultrasound abdomen consistent with liver cirrhosis. What is the diagnosis? What is the mode of inheritance of the disease? What test would you prescribe for the diagnosis, and what is treatment or what is drug of choice or treatment of choice for this patient? So a 12-year-old patient having unusual behavior and difficulty in swallowing with tremors and difficulty in walking indicates there may be problem in the brain of the patient. So he has also jaundice, brain and jaundice is associated with the liver, brain and liver disease. Okay, so patient has ultrasound abdomen shows liver cirrhosis. Patient has also cirrhosis, means patient has developed cirrhosis, and that cirrhosis is linked with brain disorder as well. So the most common condition which is associated with the liver and brain tremor and cirrhosis may be hepatitis or hepatic encephalopathy. But patient has unusual behavior, tremors, so we can diagnose that he may have uh, Wilson disease. Patient may have Wilson disease. Okay, so the diagnosis of the patient is Wilson disease. And the second question is, what is mode of inheritance of this disease? So mode of inheritance of this disease is autosomal recessive. And the test for diagnosis of this patient, we perform serum ceruloplasm for diagnosing Wilson disease, serum free copper excretion and serum free copper. So in Wilson disease, what happens? Copper accumulated in basal ganglia of the brain, in cornea, in liver. And when copper is accumulated in the basal ganglia of the brain, develops Wilson disease. The patient develops with movement disorder, tremor, difficulty in movement, difficulty in controlling the movement. And when in Wilson disease, copper is deposited in the cornea, patient develops Kesher facial ring in cornea, KF ring in cornea. And third one, when copper is deposited in liver, patient develops with the cirrhosis. So these three systems are involved in brain, basal ganglia, and eye, Kesher facial ring. And when it deposits in the liver, it develops tremor and cirrhosis. Develops cirrhosis. Okay, so we perform test serum ceruloplasm, free copper excretion and free copper of serum. So because copper is increased in the body, so it can help in diagnosis this disease. Drug of choice is penicillamine, and treatment of choice is penicillamine is that for Wilson disease. So that was the Wilson disease.